Of the day. Well, with that, let's move on and keep decoding the implications of these big GST reforms. Suneeta Reddy, Managing Director at Apollo Hospitals, is now joining in. Ms. Reddy, thanks so much for being with us. It really is a big, big day, right? And I mean, for your sector as well, healthcare and pharmaceuticals, when there's been a range of reductions, a lot of life-saving medicines. I think 33, I read the notification. 33 have seen a pretty significant price cut to 5%. Some of the life-saving drugs for cancer care, chronic care, I think some of them have come down to nil. And then a whole range of reductions on consumables, like I think, bandages, etc. So much, and medical devices as well. What would your first thoughts be? I mean, what does it mean for the business? How much of this can be passed on to customers? And how much perhaps will help improve margins even further?
I think the first part of it is, it's very important to understand that more than anything else, this is really stimulating demand, putting more cash in the hands of the consumer. This coupled with what was announced in the budget, which was reduction in taxation and therefore more disposable income in the hands of the consumer, has really spurred demand. If we were to look at it from a healthcare point of view, I think this will enable more people to have access to quality healthcare, and the significant incentive that has been given to insurance is clearly a huge differentiator. Moving to nil GST on life and health will enable more people to buy insurance products and for the insurance company to have a larger risk pool. So this should result in a huge access to healthcare, to hospitals, and the industry, I'm sure, welcomes it. The second most important thing is what you've said, that if you look at margins and you look at cost of consumption, etc., and something that is good for the patient, which is ultimately what we want, life-saving drugs moving to zero from 12% is really something that is much needed in the healthcare sector. Balance all medication at 5%, definitely good for both margins and for the consumer. And moving on to think of the detailing in a way that they have done, that includes reagents, diagnostics, consumables, bandages. All of this moving to 5% is a saving, both in the hands of the consumer and for the hospitals. It should result in an improvement in margins. So the third most important aspect of it is what they've done for the construction. And I think that in healthcare, there are people who are consolidating hospitals, but what we really need is investment in healthcare infrastructure. So this will significantly reduce the cost of construction in terms of reducing the reduced cost on cement, fly ash, granite. These are important components of construction.
Absolutely, yes, they're big.
Yes. So that will result in a saving. In about 2 to 3 days, I think I'll be able to quantify the savings and see the impact on the margin. But I must say that these are significant moves for the healthcare sector.
Absolutely. Ma'am, for things like consumables, gloves, etc., and even the drugs on which GST has been reduced, now that reduction, will it be passed on entirely to customers, or how does it work? I mean, overall, will there be a reduction in hospital bills, or I mean, it's too early to say, some indication of how this might play out?
There'll be both. In the sense that we're at negative GST, so we were never passing on, even we were absorbing all GST. So I think, this, as we attempt to work with insurance and rationalize and create packages, this is a very important component of what could enable us to be more accessible to a larger pool of individuals.
Ma'am, on the insurance bit, it's true that 0% GST on premiums will make insurance on the whole more affordable, penetration will go up. But there is that other issue about income tax credit, ITC, where, you can't claim the income tax credit. Will that result? I mean, from a hospital point of view, can you explain what happens? And is that an issue for you as you work with insurers? Is there going to be some sort of an income tax leakage?
No, this is not going to significantly impact us. The income tax leakage, I think it's more in the hands of the consumer.
Overall, Ms. Reddy, I mean, which part of the healthcare industry will see the highest benefits? Is it going to be diagnostic chains? Would it be, the drug manufacturers? Or to what extent do hospitals benefit?
No, I think all across the value chain, you will see benefit. But I just want to end with something. We do not have input tax credit. So all of this in terms of, it's really not, from this, you will not see a huge impact on consumers currently. But as we rationalize input costs because of these savings, I think net we should be more affordable.
Ma'am, for critical treatments like cancer, etc., where medicines are now GST free, what could be the drop in patient bills?
It's at this time a little difficult to tell. Yeah. There's one which is radiation, there's part which is medical oncology and some surgical. But for medical oncology, of course, this is a huge benefit.
In terms of the input tax credit not being available, I mean, that's something that obviously the insurance industry is also grappling with to see how they will, deal with this whole situation of being exempt and not having ITC. Is there any ask from the hospital sector on the indirect taxation front now with these big changes having happened?
No, there will be an ask, and I think there's precedent, which is more important. If you look at what is done for education, I think that's a good starting point for us to enumerate.
Could you elaborate on that more specifically?
So if you look at education, the services are exempt from GST. For example, all of the contract services, the outsourcing is all exempt from GST, and this is a huge saving. So if we just follow that precedent, we will continue to have a dialogue with the ministry to see if we can follow that in healthcare as well.
Okay. All right. Ms. Reddy, we'll leave it on that note. Thank you very much for joining in and giving us a quick perspective on what these GST changes and big cuts mean for the healthcare sector. Thanks for joining in. Well,
I have a fourth reason.
Of why the market's not excited. All right, go for it.
This is not mine. This is